in your 18 years of working in this field, if you look back 18 years ago, the big C that people were so concerned about, what would be the fatality rate, let's say back then, versus where are we today and where do you see us going?
So if you look back then and did medical literature searches, so if you look on the internet and you pull up from PTLD, that was a bad time back then. All they had to treat patients with was really chemotherapy and radiation therapy. But nowadays things have improved greatly in diagnosing it early. Treatments have improved to the point where I think the ratio's almost flipped around. Probably 3 out of 4, 4 out of 5 are now cured of it. So it's a much easier, safer, curable disease now than it was just 20 odd years ago.
What's it going to be like 20 years from now? What do you see for the future?
I think it's going to get even better. Just as in cancer treatment in general has improved, we've moved from a time of using chemotherapy and radiation therapy and saying that's a tumor, let's blast it, to now understanding the science behind what causes a cell to become malignant, what causes PTLD, and designing immune therapies that didn't exist 2 decades ago, targeted therapies, treatments that target these pathways inside of the cancer cell that have caused the cell to turn malignant. These things are much better tolerated and in fact I would argue much more effective for certain types of cancers.